Hi, I'm Dr. Elsa Pichardo. I'm board certified in general surgery and fellowship trained in hepatobiliary and pancreas surgery. I'm a surgeon on the medical staff of Penn Medicine Princeton Health. Today, I'm going to talk to you about pancreatic cancer and the recent news of rising rates among younger women. The American Cancer Society estimates that in 2023, more than 64,000 people will be diagnosed with pancreatic cancer, and 1 out of every 64 Americans will develop the disease in their lifetime. And while pancreatic cancer is still more common among men, a recent study found that rates are rising faster among women age 55, particularly Black women, than they are among men of the same age. The pancreas is a gland deep inside the abdomen that helps your body digest food and keeps your blood sugar levels steady. Pancreatic cancer is a fast-growing cancer that occurs when normal cells in the pancreas mutate and start to grow uncontrollably. Doctors classify pancreatic cancer into 2 main types. Exocrine cancers arise from exocrine gland cells inside the pancreas. These cells aid the digestion process. Exocrine cancers, mostly adenocarcinoma, make up most pancreatic cancers. Pancreatic neuroendocrine tumors develop from islet cells within the pancreas. These islet cells make hormones that keep blood sugar levels steady. Neuroendocrine tumors make up less than 5% of all pancreatic cancers. There are currently no reliable screening tests for pancreatic cancer, and often no definitive signs that someone has the disease. This is why alerting your doctor to any changes in your health, which I'll review in this video, is so important. In a recent study published in the Medical Journal of Gastroenterology, one potential explanation for the increase in diagnosis among women is the type and location of tumors. Rates of pancreatic head adenocarcinoma, an especially aggressive and deadly type of tumor situated at the head of the pancreas, appears to be increasing, the study found. Some experts believe that diet may play an important role. The consumption of processed foods and red meats, combined with younger adults eating less leafy green vegetables, could contribute to the increase. Americans are also moving less, and being sedentary is believed to lead to an increased cancer risk. Another factor that may contribute to the increase is spending years at an unhealthy weight or being obese. While the increase may sound small, about 2.4% compared to men of the same age, and the future studies are needed to examine the cause of these trends, this news should remind women to be aware of the risks and symptoms associated with the disease. According to the American Cancer Society, there are lifestyle steps that everyone can take to lower their risk of developing pancreatic cancer. Specifically, don't smoke. Eat a healthy diet, which means avoiding processed and red meats and sugary drinks. Limit alcohol use. Maintain a healthy weight, and stay physically active. It is important to also remember that there often are no clear signs of pancreatic cancer. In fact, typically by the time the disease causes serious symptoms, it has grown large or spread outside the pancreas. However, in the later stages of pancreatic cancer, patients may experience symptoms including abdominal or mid-back pain, nausea and vomiting, unexplained weight loss, a burning feeling in the stomach, inability to digest fatty foods, large, greasy stools, swelling in the gallbladder or liver, and jaundice, a yellowing of the skin or whites of the eyes, which can be caused when a tumor blocks the bile duct. If you have any of these symptoms or are concerned about your risk of pancreatic cancer, talk with your primary care physician. They will likely send you for an ultrasound or CT scan to help determine the causes of your symptoms. If necessary, you'll then be referred to a gastroenterologist for further testing and a diagnosis. Unlike with some other types of cancers, there is no single diagnostic test that can help tell if a patient has pancreatic cancer. A definitive diagnosis requires a review of the patient's medical history, a physical exam, and a series of imaging scans, such as a CT scan, MRI, or ultrasound, blood test, and a biopsy. And because genetic mutations can increase the risk of cancer, people with a family history of the disease should seek genetic testing and counseling. Treatment for pancreatic cancer depends on the stage and location of the cancer, as well as the patient's overall health and personal preferences. When surgery is recommended, depending on the tumor location within the pancreas, it may be able to be performed laparoscopically, sometimes robotically, which offers smaller incisions and easier recovery. If surgery is not an option initially, usually because of the size of the tumor, chemotherapy may reduce the tumor to allow for surgery. Penn Medicine Princeton Cancer Center at Princeton Medical Center offers a range of surgical options to treat pancreatic cancer, including the Whipple procedure, which is the most common surgical treatment for pancreatic cancer. The Whipple procedure is a complex surgery to remove tumors on the right side, the head of the pancreas. During the procedure, the surgeon removes the head of the pancreas, part of the small intestine, part of the bile duct, the gallbladder, and associated lymph nodes. Based on the findings of the recent study, we encourage everyone, especially women, to be mindful of their symptoms and discuss any concerns with their primary care physician.